So again the insulin part 2. So in this topic we will discuss all about the insulins, types and administration rest. So first the open bottle. The open bottle insulin will be stored in fridge up to 1 month. Open bottle insulin stored in fridge up to 1 month. The open bottle insulin stored in fridge, not in freezer, up to 1 month. Up to 1 month. Then the premix insulin is contain the short acting plus NPH. The premix insulin it contains short acting plus NPH. Yeah. The premix insulin contains the short acting plus NPH. Then continuous infusion is to of insulin is to prevent the hypoglycemia. Continuous and the continuous infusion of insulin is to prevent the hypoglycemia. Yeah. The continuous infusion of insulin is to prevent the hypoglycemia. Why? So the required amount should be set in infusion form so that it will prevent the hypoglycemia. Then route. Diabetes mellitus type 1 or the type 2. Diabetes mellitus, whether it is type 1, whether it is type 2. The subcutaneous insulin is to be administered. The route, whether it is a diabetes mellitus type 1 or the type 2, the subcutaneous insulin should be administered. So in the IV, the short-acting regular insulin should be administered. In emergency, short acting IV regular insulin is to be administered. In emergency case means the if the blood glucose level is very high in the so in this case the short acting IV regular insulin is to be administered. Means the diabetic ketoacidosis. Diabetic acidosis means the diabetic ketoacidosis. We should administer the insulin most commonly in the abdominal area because abdomen is the fastest absorption route. Abdomen is the fastest absorption route. The abdomen is the fastest absorption route. So cannot give even even insulin in periumbilical area that causes the lipodystrophy. Cannot give him insulin in periumbilical area that causes lipodystrophy. Cannot give him insulin in periumbilical area that causes the lipodystrophy. We cannot give him the insulin in periumbilical area that causes the lipodystrophy. So the hypoglycemia is more in short acting. Hypoglycemia is more in short acting. The hypoglycemia is more in short acting insulin. So the avoid beta blocker with insulin that causes the more hypoglycemia. Avoid beta blocker with insulin that causes hypoglycemia. With insulin we can avoid the beta blocker that causes hypoglycemia. And rotation rotation injection site. Rotation the injection insulin injection site to prevent the lipodystrophy. So this is all about the insulin part 2. Next class we will discuss other drugs in diabetes mellitus. So thank you to all.